Joining me today is Dr. Roderick Cameron, who has a PhD in chemistry, but has a very unusual dual career, not only in biotech, but also as a pilot. So Rod, thank you so much for joining me here in Luxembourg from America. So just to position you geographically, you're about an hour and a half outside of New York, is that right?
That's correct, yes. A little town in Pennsylvania called Nazareth, which is very close to the New Jersey border, and about an hour and a half to New York City from here, just due west.
And we know that New York is really the epicenter focus right now for the coronavirus. Do you feel that where you live? What's the general feeling in America where you are right now?
Yeah, I think there's definitely a lot of anxiety in general amongst folks that I've interacted, obviously, all through the phone or internet connections. Obviously, we can't really do a lot face to face these days, and I think yes, the general sentiment is that being so close to New York, going out and about, and you don't know if some people have come from that area or are traveling through. Just the concern of picking up the virus from contacting surfaces outside of your home and then bringing them back to your home is definitely a big concern for people. So I think we're certainly feeling as if we're doing everything we can to protect ourselves, sanitizing everywhere, but there's the unknown risks of going outside the home, even if it's just to go and collect shopping or essential supplies, which we are allowed to do. Of course, Pennsylvania as a state is also on a lockdown, so you're only really supposed to leave the home for essential items and things like that.
And when it comes to shopping, there's been some statistics out about what Americans are shopping for, including guns and rifles, which I think has gone up for about 800%.
Yeah, so well, it's been deemed that obviously it's a right that the United States Americans have to own guns and weapons, and the feeling was that food and other necessary items, the gun stores were declared to be necessary, and when were asked to open their doors, or allowed to open their doors, probably is a better way of saying it. And consequently, people are concerned with the anxiety of protecting themselves, perhaps more now than ever. I think there's always a fear of lawlessness. I think that law enforcement and those agencies are doing a wonderful job, but there's always, I think, a fear or anxiety that during situations like this that that lawlessness could happen, and people want to be able to protect themselves if law enforcement aren't available.
Well, that makes me think directly of healthcare.
Yeah.
The health situation for people in America. I know you have worked and still consult in the biotech field. Can you tell me, now living in America for quite a number of years, what your perspective on the American healthcare system is to withstand a pandemic like this?
Well, I think frankly we were never prepared for anything like this, but it's the reaction to the situation that we're dealing with right now that is prioritizing dealing with the pandemic. So what you'll find is that a lot of non-essential procedural operations that people may have had scheduled are being delayed because all priorities are really on dealing with people that are coming in for symptoms associated with the coronavirus. And so I know this because I have physician friends who are orthopedic surgeons and other surgical related activity, which is still important, but when people have a scheduled knee operation or something like that, you're finding that's basically not the priority right now, and those resources are being tailored to support the situation we're in right now.
And when it comes to a vaccination, you and I both know that normally the length of time that takes is 10 to 15 years, but it's being pushed through at a rapid rate with chemists working globally, sharing information, and yet politically between countries, it seems that things are not quite so easy. What's your thoughts on this?
So I'm aware of a number of efforts to help develop a vaccine, but as you say, it takes a long time to come up with a vaccine. Now, I was fortunate at the time to be working for Sanofi Pasteur when we had the H1N1 pandemic 10 years ago, and of course that was a flu-based pandemic where the technology could be reapplied from traditional flu to the novel H1N1 at the time, and we had a vaccine within 2 or 3 months. With coronavirus, it is there really is no vaccine out there right now for any type of coronavirus that exists. So, the basis of a technology to treat or a vaccine to prevent, an infection, it's just not there. Now, having said that, there were programs with a number of companies that I am aware of that had been essentially put on the back boiler over the years because the focus of attention of a lot of companies were in different areas, such as dengue fever and, other like malaria and things like that, which were other priorities. And of course, now those programs have been reinvigorated and they're working on them. And I'm actually supporting a couple of companies who are trying to help make those vaccines. But you are right, even if we start today, we could be years away from approval. But the good news is that regulatory agencies like the FDA are, supporting rapid acceleration of those programs, unlike before, where they, recognize the urgent need and, are obviously trying to help speed that process up.
But just going back to what you said about H1N1, when you were with Sanofi Pasteur, you came up as a group with a vaccination in just a couple of months. How did you manage that?
Well, as I said before, it was on the basis of the influenza virus that, is commonly known. And, the process there is really a case of getting hold of seed virus from the CDC. And essentially,
explain that for people.
The Center of Disease Control. So the CDC is the agency from the U.S. federal government that is really in control of viral stock material, and they're the ones that identified the virus and have actually got access to samples. They're based out in Atlanta, and that's where they basically have all the coordination for all of these pandemics and viruses. And they are the ones that release the material to the manufacturers, who are then able to take that material and essentially grow it in a controlled environment. In this case, it was eggs that are then controlled, and the virus is attenuated, which means basically the replication process of it, which infects you and makes you unwell, is reduced. And basically we go through a process of recovering parts of the virus, which then are we call it an antigen, and that antigen is then used as a vaccination to help your immune system build immunity to that virus. And that's the process basically that you make a flu virus vaccine. But coronavirus doesn't work the same way. It has a very different genealogy to H1N1. If you remember, H1N1 is actually a mix of swine and bird, avian sources, as well as human genetic material in there. And as we know, coronavirus is not like that. In fact, coronavirus, as we understand it, has actually got bat DNA in it. And we don't really have a lot of information on how to treat that. So we're trying right now to develop these vaccines, and most of the research now is directed towards antibodies, where antibodies can be isolated from humans that have recovered from the virus, and we study those to try and see if we can find a way to grow and make more of those antibodies as potentially a treatment option.
Well, CureVac in Germany have been in the news for being high up there on the route to trying to find a vaccine, along with other countries as well. But just in general, to sum up, what's your feeling about the whole, or two aspects, the health aspect of this
Hmm.
coronavirus for Americans, and also the economic business aspect from your point of view?
Well, health-wise, as I said before, it's the anxiety, of getting exposure, loved ones being impacted, and then obviously, if you ended in the hospital or in an environment like that, you're going to be separated from your family for, isolation reasons. Um, and so, that is certainly a concern. I think that, people are, taking the best approach they can by, staying in their homes and staying at home and not exposing themselves. But the financial aspect that you ask about, I think everyone's concerned. I mean, what we're seeing right now, I just saw on the news essentially what I heard was that this morning that there's over 6 million unemployed registered as unemployed now. And I think before this all took place, we were around 2 million unemployed. So we went from 2 to 6. So we basically tripled the number of unemployed over the space of 3 weeks since we started this sort of lockdown. And I think that's a huge concern for everyone, because it's only going to get worse, and we are in lockdown till April 30th minimally, according to the president. And so we're just at the start of it here on the 2nd of April. So I can imagine that figure is probably going to jump higher.
And just thinking about that, you mentioned the lockdown till the end of April. It's the same for us over here in Luxembourg, but also
Yeah.
you have elections coming up. Do you feel this lack of a net from a European point of view? We often think that Americans don't have that net of social help available to them that we do often have in Europe, just help financially or health-wise. Do you feel that might alter the way people vote?
I don't know. That's a good question. I think that, certainly everybody, I mean, the whole healthcare topic has been going on as a very big political issue for years in the United States. And that's, excuse me, partly because, there are very different views on either side about how that's funded. And I think that, this pandemic has, forced an issue in some ways, that, we're obviously not prepared for this sort of situation, regardless of whether people have the money to pay for their treatment. But this has pushed, certainly, I think, people to think hard about, how they prioritize, their healthcare going forward. And there has been an opportunity for everybody to get healthcare through the Affordable Care Act, which was put in many years ago, but it's still in effect. It's just a diluted version of it now. So yeah, I think it does affect that politically.
Rod, thank you so much for your
Sure.
time, and we wish you and
Absolutely.
your family very, very well.
Thank you. All right. Thanks, Lisa. Bye-bye.